I had a previous coworker that put it this way. He was saying, like, for Alaska Natives, in talking about maybe the federal government, or, he didn't mention, but that's what I assume, that, they took our land, they took our language, and they gave us health care.
So, is your lip starting to feel kind of tingly right here?
Alaska Natives and American Indians get a lot of their health care for free. This is because the federal government pays for some of it by allocating funds to Indian Health Service, or IHS, a division of Health and Human Services. This setup was first established in the Constitution as a result of some treaties between the U.S. government and tribes. Given this deal and the fact that Alaska Natives and American Indians are exempt from tax penalties for not signing up for health insurance, many tribal members don't understand why their healthcare providers are trying to get them to sign up for exchanges through the Affordable Care Act.
Is it still hurting as much as it was?
Over 100,000 people who live in Alaska self-identify as Alaska Native or American Indian. But as of March 31st, 2014, only 115 of those had signed up for health insurance through the Affordable Care Act.
So is she trying to do an application for herself to get coverage?
Right, so we were just going through the verification process. She's American Indian.
There is some resistance, and I think that comes from people's feeling that our nation, our federal government, made a vow to the Native people of our country to provide health care for them. And so why should they get additional care? They should just get increased funding to make sure that they get the care that they need wherever they are. And I understand that. It makes a lot of sense to me. But unfortunately, that's not the way it is. And so the marketplace, though, is especially good for Alaska Native American Indian people because they're the only ones who can apply any month of the year. So there are special benefits. They're the only ones who can get this no deductibles and no co-pays if you are in this certain range of federal poverty levels.
So maybe this is too soon to ask this question, but so if this doesn't work out, say, or they decide they don't want to do this anymore, so then am I going to start getting charged?
No.
Not everything is covered by the Indian Health Service. So this broadens what's covered. And Native health consortiums and tribes get a very limited amount of money from the Indian Health Service, and it's been pretty flatlined for a lot of years. The healthcare costs are rising all the time, and especially in Alaska, we have one of the highest costs of healthcare in the nation.
The benefit for you is that it makes it easier. Say you have to travel up to Anchorage, or say you need some sort of referral. It's going to be easier when you have health insurance because insurance will cover it, versus having to figure out, okay, who is the priority person that needs to go?
Oh, okay.
Because we have this limited amount of money.
Oh, okay.
To understand why there are funding gaps for healthcare for Alaska Natives, it helps to understand how the system is set up. Alaska Natives have chosen to administer healthcare for themselves in their state by taking funding from IHS.
Alaska Natives have made the decision to exercise self-determination and self-governance authorities under the Indian Self-Determination and Education Assistance Act. So the entire part of the health system that used to be federally operated is now managed by Alaska Native tribes and tribal health organizations.
Southeast Alaska Regional Health Consortium, or SEARCH, manages healthcare for 18 tribes in Southeast Alaska.
As an organization, we could choose to take our money from the IHS and provide that amount of services, and that's less than half of our total funding, and kind of our message to those patients who are eligible for insurance or who have insurance but don't feel like they need to give us that information, because some of our patients don't. Why do you need that information? That's additional revenue that allows us to provide the services that we do provide closer to home.
One of the main challenges providers face is that many Alaska Natives live in remote villages that are often 100 or more miles away from the next place.
So cost of care in a traditional healthcare organization is quite different than it is because of our transportation issues, cost of living issues, and probably the biggest problem is lack of medical providers.
Looks like the redness went down this way, though.
Yeah.
Many of these communities only have small health clinics, often without any doctors.
There's only so much that can be done in some of the smaller clinics, and so we have a regional hub, a regional hospital.
Surge's regional hospital is located in Sitka, but even that hospital can't offer all the specialty care patients need. In those cases, patients are usually sent to Anchorage, to the Alaska Native Medical Center. In spite of these challenges, Alaska's tribal health consortiums have garnered a lot of praise, and that may be one of the reasons it's been so difficult to get people to sign up for health insurance through the ACA.
The Indian Health Service care in Alaska is really excellent, and so that makes it even a little bit harder. So I'm really trying to get the word out about that, and I have been enrolling people. And again, it's just going to take time.